with respect to a few other considerations. Most of these were mentioned earlier, but I wanted to talk in a more sort of inclusive way about several issues. We had noted, and it came up in the discussion, that when it comes to this notion of involvement or compliance or the amount of data received, there's a variety of issues that come into play. Some of them are more sort of user-side issues having to do with desire for privacy, familiarity with phones, and frankly, the ability for people within the context of lives that are sometimes very, very busy to keep phones adequately charged and keep maintaining them in a fashion that will be supportive of meaningful data collection. There's also a set of technical issues which, to be sure, interact some with user-side issues having to do with the limited battery life on the phones, the fact that the plans in which people are enrolled or the levels of Wi-Fi connectivity that they have may vary. If one is considering transporting data over a cell phone network compared to a Wi-Fi network, there's going to be significant trade-offs. So with a Wi-Fi network, often the speeds are higher, but for many people, particularly those who are from low SES groups, the connectivity, the opportunities to connect with a Wi-Fi network may be limited. They may not have Wi-Fi at their home, and many homes they go to. They may have very limited encounters with Wi-Fi within their activity spaces, and as a result, that their appearance of their phone to upload data may only be occasional. And so it will not be an unusual thing for you to have to wait a day or two for data that has been collected to be uploaded. And in the several studies that we have conducted with low SES populations, both here in town, in New York City, and in Boston area, and now fanning out to around the U.S. in coming months, this is a notable feature of the situation. People generally who are from low SES communities will often have a longer latency, a longer time until the data they've collected gets reported. That is not necessarily indicative of a failure to comply. It's indicative often of a lower set of opportunities to connect. So Wi-Fi has the virtue of being free for many cases where one encounters it. One doesn't pay for it, which makes it very attractive in dealing with lower SES communities. However, one has to be patient and reflect the fact that if it's been 2 or 3 days since a given participant reported in, it's not necessarily grounds to call them or to contact them and find out if they're okay. It may just be an indication that their activity space doesn't involve Wi-Fi. For many of these reasons, we have gone with our low SES populations to a model which relies on cellular connectivity. Now, this raises its own set of issues, and in some ways we found those even more challenging to deal with than with the Wi-Fi issues. With low SES populations, you want to be very sure that they won't be subject to what are sometimes called overage charges if their use of cell phone networks exceeds particularly the data plans exceeds the allowance for their particular data plans into which they've elected. So many data plans, both in Canada, in the States, and worldwide, have an upper limit on how much data you can upload each month within the pricing envelope of the plan. There are unlimited plans, but they're comparatively pricey and often out of range for low SES individuals. So while providing cellular connectivity is desirable from the standpoint continuity of connection with respect to uploading data. While it helps raise the chance the data will be reported more quickly, it does raise the very important consideration that we don't want to impose charges on people who are participating within our studies. That will be grounds for uninstallation of the app by those individuals, or opt out if the studies it may be hard to recruit. As a result, for the studies we have run with these individuals, we've typically provided data plans. So we've either topped up existing plans or provided prepaid plans to individuals. And this has meant putting aside the risk of that they will be subject to charges, but it has involved its own complications. There are few things more inimical to people's desire to participate in a study than to be told that they have to change a carrier to opt into the study, that they have to go with Verizon where they had been with Bell or what have you. And in general, it is tricky to, it adds an extra level of logistics to have to manage data plans for participants. For low SES individuals, as Kevin mentioned, increasing numbers do carry smartphones, and it is ranked as one of the necessities of life up there in the top 3 or 4 that those individuals view as most valuable in their lives, because it means connections often to social networks on which low SES individuals rely heavily. So protecting people from overage charges while at the same time helping to ensure more or less continuous connections with the network is one of those balances that we've had to stretch. Our current best level of comfort is topping up existing plans that people may carry. So if they carry a phone that they have already, we encourage them to opt into a study with that phone, to download an app such as Mohammed has presented, the Ethica app. And while Mohammed had to configure that in a real hurry last night in half an hour, and in most cases it can be rolled out in a very carefully tested fashion, and we can enroll people once it has reached a certain level of test coverage. And then we provide people an extra incentive in the form of getting them a more high limit plan in the course of the month, or just paying them some amount of money per month to enroll. That will cover any extra charges associated with the plan. We have also increasingly favorably viewed wireless connectivity as favorable, even though it does have longer latency, even though it means that we may not hear back data from how someone answered some questions for 3 days since they answered it, because it is a low cost option, because it has no risk of overage charges. It is quite attractive. What's that? Yeah.
One of the things we've talked about doing but never implemented, but is not that terribly difficult, would be to do a daily text from the phone, which basically is just saying what's on the phone, how many records you can on the phone, text that to.
That's a nice idea. Yeah.
That way, pretty much you can text from anywhere except Jared or Fuego or something like that, northern Saskatchewan. So at least you know what pending is on.
Yeah. There are for our remote communities in Saskatchewan, there certainly are many communities where the cell service is poor. On our farm, it's very poor. I don't know in Cheryl's area, but we have very inability to connect from our farm. So there are certainly barriers there, but certainly the text would go out a lot sooner than if we were relying on Wi-Fi connectivity. This is a big challenge. I'll tell you, I can't tell you what to do there, but I can tell you what not to do. There's an ANSI pattern which we've used in 1 or 2 studies, which I would advise against, and that is asking people to, even though it's very convenient from a logistics standpoint, to go with a single carrier, a single phone plan, and use that as the standard model for all your participants, although that avoids certain headaches, including differences between carriers and what apps are installed on a phone in terms of their policies with respect to the rates at which they start charging overage, et cetera. Although it is very convenient to go with a single carrier, we have found that switching people over to carrier plans is really problematic. And where it hurts the most is recruitment. People will say, I just don't want to switch plans. I don't want to switch to this other company. And particularly, again, with more vulnerable groups, it can be very problematic. We have also found phone cards, handing out prepaid cards, to be a lot of work on our part, and I'm not sure I would advise it for other studies. So if you can ride atop Wi-Fi, if you can build into your study plan enough flexibility that getting data delayed by a couple days isn't a big problem, or if we can put in place an alternative mechanism like texting for that would indicate number of records received, I think that would be highly favorable. This is an area of great interest to us in the human theater of running these studies, and hopefully it's one that Ethica's system will come to more and more richly support. Phone failure is something that we see. Phones break. Phones are dropped in toilets. Phones, batteries get exhausted. If you are thinking about handing out phones to people, and I would be cautious about that, but note that if you're dealing with low SES communities, this may be quite important to have as an option so that people won't be dissuaded because they don't have a phone initially. You don't want the digital divide to afflict your study in a very pronounced way. If you are considering handing out phones, be careful to use phones where possible, where the battery life is rated very favorably, and secondly, if possible, where the batteries are replaceable. This is increasingly challenging. A lot of phones now are not supporting replaceable batteries, but if you have a deployment set where you hand them out for 6 months and then you want to recycle them for another group, being able to replace the batteries between those times may mean a difference of a factor of 2 in battery life for the new group, because batteries lose the ability to carry charge after a certain amount of time. Even lithium ion and so on, they might not suffer the memory effects seen with NiCad, but they do wear out over time. And many of us in the room will likely have seen this with our phones, with our laptops, or other personal devices. So phone failures, particularly on battery, are common. Phone failures of other sorts are also known, and one has to be prepared to deal with them. As Mohammed indicated, phone components do fail. Sensors fail on phones. And it's not necessarily the whole phone that's failed. You have to be a little bit vigilant about the data that's coming in to spot possible cases where a phone component has failed and where you may want to notify the person involved or offer a replacement phone for them. I guess I should say, because I'm talking about this issue of opt-in and of compliance, gosh, boy, am I looking forward to deep sixing that term. To involvement or to degree of or amount of data received. Data completeness. I like it. Okay. Data completeness for individuals. I should note that, and because I talked about recruitment, I should note, if you want to attract people to your study and you are giving out phones, say to low SES individuals, it is better to avoid the risk of being penny wise, pound foolish with respect to phone selection. One of the issues that we've encountered, and admittedly this is for low-income teenagers in the States, is that, well, we gave out a phone that I thought was pretty nice. From their perspective, it wasn't very nice. It wasn't nice enough. And many of them opted to not use this phone because they didn't think it was spiffy enough. And they thought among their peers, people would look down on them. The fact that they have a Samsung Galaxy S3 Mini as of last summer was just not prestigious enough. In retrospect, we should have paid twice the amount and gotten them an S4, S5 that they could have showed off, and that would have been a real asset for them. And so we had the risk of losing people that was really manifested in many places because people wouldn't opt in for this kind of low-end phone. Low-end phones can be great for the budget side, but you may end up really putting a lot of effort in to recruit people that would be needless, that you could have avoided. And you may have failure of data completeness in terms of how many people carry the phone as a result. So again, penny wise, pound foolish. Don't shortchange your study just to save a few bucks up front if possible. There are some, what I have termed, and I apologize for the term, burn-in effects. There are effects that change in the first few weeks of studies. And one of the first studies we ran with low-income participants in New York City, we saw signs that the first day or two of data collection was adversely affected because people were not yet into the groove of carrying the phone, and they were treating it as a novelty, going around and altering their daily patterns of use. And in general, there are also effects associated with opt-in in terms of snoozing data, which often manifests for the first few days of a study, and then people sort of go into a mode where the vote is more routine in their life, and they're not as conscious of being monitored and of Hawthorne effects, and not imposing Hawthorne effects that come from that. So within the first week or so of a study, one has to be a little bit cautious about how representative the data would be, particularly if it's a new phone. Let's talk about a few past measures of this. Compared to the Ethica app, the lab version of IEPI that we maintain has very strict duty cycles that can be imposed on a per sensor basis. In other words, you could specify for this sensor measure this many seconds every so many minutes, or this many minutes every 10 minutes, or what have you. And we will often impose a well-defined duty cycle that might be 5 minutes long exactly for these studies, and can ask, okay, what fraction of those duty cycles has data been received? So this again is a completeness measure, and often we do it with battery data because that data is more reliable. It's supported on all models of phone. And so it might say, 45% or 46% data completion as judged by this measure. By contrast, the Ethica version errs on the side of having better battery life and doesn't have as strictly a defined duty cycle. This is a bit of a trade-off, and it's one of those areas where feedback would be really valuable, but whether a strict duty cycle would be desirable or whether preferring battery life over that might be more favorable. We've also looked quite a lot at things like the fraction of the surveys that have been answered. We are currently very interested in also measures that would look at per survey question response, the degree to which people have elected to answer a given survey question. Think of a long-form question that relates to a person describing their feelings about an anti-tobacco ad. To what degree have they opted into that? And even keeping track of how long they spent to answer different questions. the amount of time they spent for a given question may be indicative of how seriously they considered that question, and the amount of thought that they gave to it. Sometimes people answer questions in a very routine way without giving it a lot of thought, and looking at that time per question can be valuable. Frequency of snoozing is something we've also looked at. It's been very eye-opening in terms of looking at the variability between study and between people. And then crowdsourced contributions, say, in terms of pictures provided. So this is an example from one of the studies that we were running here in Saskatoon. This is a study of women with gestational diabetes, following them for 6 months over the course of their pregnancy and then postpartum until until a checkup where an HbA1c score was taken. And here, what we have is bar graphs. This is courtesy of Winchell, who's just unbelievably good at analysis tasks. And what we were doing is we were looking at for different. So these bar graphs, these box plots are summarizing data on a per day basis. So a given data point being summarized in here would be, for a given day, what fraction of all possible data in terms of battery, and what fraction of all possible duty cycles had data associated with them, battery data. And what you can see is that for some participants, we had very high completeness of data. Some participants, we had comparatively low reporting of data. Some participants had very wide variability and some more narrow variability day by day in terms of data completeness. And so this was, participant 5 here was a particularly strong contributor, but there were some days that for that person that are outliers in terms of the fraction of data reported by a day. So this is data from that study. Here's another one from that same study showing the fraction of data that was concealed. So the lab version of IEPI, like the version that you've seen from Ethica, has a button to snooze the phone data collection. What that means is during that time, it will not collect sensor data. Surveys may still be issued, and people can elect to answer them or not, or skip questions on a question-by-question basis. But this is indicating what fraction of the time the phone sensor-based data collection has been snoozed. And what you see is great variability here. Here we are looking at a different measure. Interestingly, you'll notice that phone number 5 here is the same one where we have seen an absolutely huge amount of data being concealed by this person. This is a person who is very persistent in snoozing phone data collection for privacy reasons. That same person had very high levels of duty cycles to which the phone was giving some indication that it was still live and sending along data, but most of the times the data that was sent was indicating it was snoozed. In other words, it was placeholder data indicating no real data is available here. Similarly, for this person, number 3, we had 45% of data as the median for which it was snoozed. In other cases, it was much smaller. This was a real outlier as a study. We have never seen anything approaching this in terms of level of snoozing. This is for low-income, predominantly low-income individuals with gestational diabetes here in town. And it stands out as being a very unusual in the levels of privacy being requested. For most of the studies we've run, we have seen a number of instances of where people press snooze that they're extremely small, fewer than one time per person in the study over the entire course of, say, a month or several months of study data collection. But this is an important thing to look at. Another thing we sometimes, yes. Yeah. Yeah, there was some discussion with the participants, and some of the participants, actually, it wasn't a concern for themselves for privacy, it was a concern of family members. This affected some opt-in as well, and these discussions often took place in the context of enrollment. Some people's husbands, for example, were concerned about privacy for themselves, and were wary of having a phone that would be carried around by family members. That's a good question. We'd have to look at that, Jenny. We could get that result for you this afternoon if you're interested. So another thing we've looked at is kind of battery levels for participants. This was particularly a need in earlier versions of IEPI, which were quite battery intensive. The latest version of both the lab IEPI and the Ethica version of IEPI have comparatively good battery performance, although there are limits, as William can attest. There are limits to how much data you can collect within the battery envelope of the phone. And here we were looking at sort of a degree of variability seen for battery levels on a participant-by-participant basis, and the reflection being that some individuals might have had a hard time keeping the phone charged. And you could see that most individuals actually did at one point or another essentially drain the battery, but by and large they were keeping the phones within levels of sort of battery range that were appropriate. Now, this is a different measure of compliance. So I had a very naive view until this study concerning this notion of data completeness. And my thought was that if someone was careful carrying the phone, they would also probably be of a personality type that would be careful answering questions on the phone and volunteering information, say, to take photos of their meals. And what we found is actually something quite different. For this study, this was, by the way, a study run with Jill Angel-Newsted and Roland Dick. What we were looking at here was a situation where we'd occasionally ask the women to take photos of meals. This was designed to be low burden, and I think maybe I can't remember what it was, 2 weeks for the study or something like that, on a certain day we asked them to take a photo of the meal. I can't remember the exact rule for it. But by contrast, we did ask them to record blood glucose testing on a more regular basis. And what we found here was, some individuals were reporting more meals, but almost no blood glucose testing. Some individuals were complying quite a lot in terms of blood glucose testing, but were submitting comparatively few cases of meals being reported. So here we saw real differences, and in general, what we see within our studies is quite limited in terms of covariation between compliance as judged by different measures. So